Hello, my name is Savannah Garrett, and this is my narrated PowerPoint assignment for the Bachelor's of Psychology program at Liberty University and the Psych 430 Abnormal Psychology class from Professor Brimmer. I'm sorry if I mispronounced your name. So the first thing I want to talk about is narcissistic personality disorder and explaining the DSM-5 criteria for this disorder. According to the DSM-5, the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, posted by the American Psychiatric Association, narcissistic personality disorder is considered a personality disorder. So personality disorders are marked by inward perception or feelings and outward behaviors that differ from a person's cultural norms. Personality disorders often include uncontrollable or intrusive fixed mindsets. They often occur during adolescence and young adulthood, and they can enhance distress and hinder one's quality of life. So these personality disorders are very uncontrollable, and they are not necessarily wanted by the patients that exhibit them. Narcissistic personality disorder is mainly marked by feelings of great superiority or grandiose self. So it is marked by a person feeling maybe they're special than someone else and they deserve better treatment than someone else simply because they are them, not by their achievement or anything like that. It is also marked by a high need to impress other people or to be appreciated, according to the DSM-5. Also, according to the article DSM-5 Criteria and Domains for Narcissistic Personality Disorder, Evidence from Network Analysis Based on the Mental Health Professional Perspective, the authors mention that those with narcissistic personality disorder often focus on themselves rather than problems in the world or problems with other relationships. Those with narcissistic personality disorder often have strained relationships. They also have high levels of guilt, shame, fear, and perfectionism. According to the DSM-5, those with narcissistic personality disorders may have symptoms of isolating themselves from other people in order to not be found out because they are often insecure or feel inadequate. So they would rather isolate themselves to not feel that way. The DSM-5 also says that they can come across as manipulative or exploitive or using other people. They can also come across as being surface level and not going deep. That's also because of that fear that they might be found out if someone finds special information on them or deep information. They don't want that to be used against them. Potential causes of narcissistic personality disorder. According to the article Adverse Childhood Experiences Leading to Narcissistic Personality Disorder, a case report, narcissistic personality disorder can be caused by adverse childhood experiences. So these can be physical abuse, sexual abuse, substance abuse, family violence, exposure to parents that have mental health decline, or alcohol abuse. Any of those experiences can heighten someone's likelihood of developing narcissistic personality disorder. There are also biological and physiological factors that contribute to this in people's genetics. If someone has a heightened sense of awareness or heightened anxiety, or they are just anxious or exhibit violence, their children are more likely to carry that gene. However, parenting styles can impact the development of narcissistic personality disorder. So, emotional or physical neglect or negligence, also overpraising or overcriticism, according to Ross, the main author of this article, or the authors in this article mentioned that parental involvement and overpraise or overcriticizing their children can develop narcissistic personality disorder, and that is a main cause of it. Social and cultural factors that contribute to narcissistic personality disorders. According to the article Counselor Perceptions Regarding Narcissistic Personality Disorder, Narcissistic Traits and Domestic Violence, the authors conclude that patients with narcissistic personality disorders are more likely to cheat on their partners or engage in physical or sexual abuse. So they do contribute to the statistic of often being an abuser. And according to the article, culture and individualistic self-construal moderate the relationships between childhood experiences and narcissistic personality psychopathology level in adulthood. Someone is more likely to be diagnosed with a narcissistic personality disorder if they're born into wealth, or if their family has significant amounts of money, or has a perception that they are on a social hierarchy. So if someone grows up in a home where they believe that they are superior to others, it can contribute to that development of narcissistic personality disorder. Also, families that are wealthy and successful are more likely to have children that develop narcissistic personality disorder. In this article, Culture and Individualistic Self-Control Moderate the Relationships Between Childhood Experiences and Narcissistic Personality Psychopathology Level in Adulthood, the authors also mention that Turkish people who were born in the regime change from being more collectivistic or controlling to individualistic, where they kind of form their own thoughts, they are more likely to develop narcissistic personality disorder because now they can compete with each other. Whereas Japanese people who are more collectivistic cultures are less likely to develop narcissistic personality disorder. So these are all social and cultural factors in developing narcissistic personality disorder. According to the article, gender stereotypes were proposed DSM-5, negativistic, depressive, narcissistic, and dependent personality disorders. The authors also mentioned that men are more perceived to be diagnosed with narcissistic personality disorder. So society perceives that men often have this disorder. However, women can have it too. So that is important to recognize the gender bias as well. Narcissistic personality disorder treatment. According to the article, Counselor Perceptions Regarding Narcissistic Personality Disorder, Narcissistic Traits, and Domestic Violence, narcissistic personality disorder patients often struggle with choosing to participate in treatment. They might not realize that they need treatment, and then if they do choose to do treatment, there's a high likelihood of them not completing the treatment. The authors also conclude that a greater success rate occurs whenever counselors collaborate with their patients. So whenever they ask them to be a part of their treatment plan or make them feel important in their treatment plan. According to this article, psychiatric residency training in personality disorders, becoming a good psychiatrist to becoming good enough at treating borderline and narcissistic personality disorders. The authors conclude that transference-focused psychotherapy and dialectical behavioral therapy are successful treatments for narcissistic personality disorders. They also use a technique called good psychiatric management. So this approach helps patients examine their self-esteem, and it helps them regulate their extreme thoughts. So if they see themselves as extremely grandiose, or if they see themselves through extreme insecurity, it helps them figure out their self-esteem, and it helps them alter those defense mechanisms. If a patient can see that they can accept their insecurities or accept their ways of thinking, that they do view themselves as more grandiose than they are, then they can make changes to alter those thinking patterns. Preventing narcissistic personality disorder. According to multiple sources mentioned in this video, there are a lot of parental responsibilities and parental roles in developing this disorder. Therefore, prevention can include parental awareness. In the article, Adverse Childhood Experiences Leading to Narcissistic Personality Disorders, a Case Report, the authors mention that excessive criticism and excessive praise are major contributions in developing narcissistic personality disorders. So parents should consider how they are interacting with their children. If they are interacting with excessive praise or excessive criticism, they should monitor the feedback that they're giving to their children. They should also monitor where their children are prioritized in their life. So if the children are the main priority and they view their identity within their parental role, then they're more likely to put pressure on their children to be great people or to make them feel as if they're more special than other people. This can develop narcissistic personality disorder. According to the same article, it also mentions the likelihood of adverse childhood experiences. So if parents can monitor instances of neglect or instances of abuse, that can also decrease narcissistic personality disorder. Biblical integration. I think of the scripture in 1 Corinthians, love bears all things, believes all things, hopes all things, endures all things. And this scripture just shows that when we love our patients, that we should bear with them and believe the best about them in their treatment plans, because they deserve the best treatment as possible, and as Christians we're called to love them. Thank you for listening to this presentation on narcissistic personality disorder.